Hi everyone, my name is Katrina Wong, and today we're doing a Q&A on pregnancy and pelvic floor physical therapy. Thank you for attending, and I'm looking forward to sharing some really great information. If you have any questions, feel free to type in the chat. I'll likely answer the questions towards the end of the Q&A or the presentation, but feel free to ask any questions, whether it's pregnancy related or pelvic floor physical therapy related or anything PT-wide. All right, so I'm just going to share my screen. Okay, so okay, can you guys see my screen? Okay, great. So I'm just gonna, okay, great. So today, again, we're gonna talk about pelvic floor physical therapy during pregnancy. And the idea is that we're just gonna talk about how pelvic floor physical therapy can be helpful during your prenatal season. So again, my name is Katrina Wong. I'm a doctorate of physical therapy. And I graduated from Mount St. Mary's University in Los Angeles. I'm really passionate about pelvic floor physical therapy, women's and men's health. I treat a variety of conditions. So for example, urinary incontinence, constipation, fecal incontinence, tailbone pain, back pain, pelvic pain, as well as working a lot with pregnant and postpartum moms, in addition to helping men with their sexual dysfunction as well as post-prostatectomy rehab. So those are just a few things that I treat and assess, just to get to know a little bit about me. As a health disclaimer, this workshop is for educational purposes only. This is not treatment. It's only meant to provide like general education. So just keep in mind. All right, so what we're gonna learn today. So today we're gonna talk about 4 reasons why you should see a pelvic floor PT during pregnancy. An easy tip you can incorporate into your daily activities when you are having some pain, whether that be back pain, pelvic pain. We'll also go over 3 stretches that you should perform during pregnancy to prepare your body for labor and delivery. We'll also talk about 3 labor positions to optimize delivery as well as decreasing the risk of tearing. And then lastly, we'll talk about what pelvic floor physical therapy looks like during the postpartum period. So that's a little bit about what we'll talk about. So we'll first dive into what pelvic floor physical therapy looks like during pregnancy. So we'll go into 4 different areas. So the first area we'll talk about is comfort and pain relief. So we'll talk about how we can help you relieve any pain that you're experiencing during pregnancy. We'll also talk about labor and delivery prep that we can provide. We'll also talk about pelvic floor and core strengthening and rehabilitation. And then lastly, we'll talk about how we can help you prepare for your 4th trimester, which is the immediate postpartum period after you deliver. So we'll dive into the comfort and pain relief section. So you may be, if you're pregnant, you may be experiencing low back, pelvic, groin, hip, rib cage, or abdominal pain. And this can really impact your daily movements, whether that's getting up and down from a chair, walking, standing, and rolling in bed. You may also be experiencing pain with intimacy or having pelvic examinations with your OB, or you may be experiencing nausea. So any of these symptoms that you may be experiencing, you can be experiencing it from the 1st trimester with the nausea, or even later towards the 2nd and 3rd trimester as you're trying to move. So as a general treatment strategy, we could provide you some manual as well as soft tissue techniques to relieve any muscle tightness or restrictions. We could also provide some strengthening exercises to address any muscle imbalances, as well as do some functional training to get you back to walking, rolling in bed comfortably. So that's just a general slide about what you may be experiencing and how it could be a good leeway into getting some pelvic floor therapy. So we're going to talk about two different conditions that I commonly see in my pregnant soon-to-be moms. The first one is pubic symphysis pain. The next one is round ligament pain. So pubic bone symphysis pain, this usually occurs towards the second and third trimester of pregnancy as the uterus starts to get bigger, the baby starts to grow. And it typically, again, occurs because the pelvic joints become very stiff or they don't move very evenly. So as you can see in this diagram, the pubic symphysis is the center point where the two pelvic bones meet. This can also occur if the baby is resting on your pubic bone. So if the baby isn't sitting nicely into the pelvis. It can also be due to poor stabilization from your abdominals or your pelvic floor muscles that can contribute to the pain. So again, as you are pregnant and you start to expand in your abdomen, the abdominal muscles start to lengthen and they don't function as well to provide you some support and stabilization. As a result, you may be relying on more of the ligaments or these bony structures for stabilization. So your pubic bone area could be having some distress. So common symptoms for pubic bone symphysis pain includes pain localized to the pubic bone, so right in the center, the vagina, as well as the lower back. And people very commonly report that they have discomfort with single leg activities. So walking, stairs, as well as putting on their pants, for example, like standing on one leg. So that's a little bit about pubic bone symphysis pain. We'll also dive into round ligament pain. So this is also a really common condition that pregnant individuals experience. Now, these round ligaments are cord-like structures, as you can see in the picture, that attach from the uterus to the groin region. So as your baby is getting bigger, that round ligament is going to stretch and become more soft to accommodate the growing uterus. Again, this typically happens during the second and third trimester of pregnancy. And what happens is if the round ligaments are working really hard to kind of keep the uterus in place or to really stabilize yourself, the ligaments can become tight, they might spasm, and then it can result in some pain. So again, these ligaments end up having to work really hard as you grow bigger because your abdominals won't be working as well. So the ligaments, again, are going to be working extra hard to keep you stable or more supported during the pregnancy. Now, patients typically report experience pain in their inner groin or lower abdominal region. They also report having discomfort with rolling in bed, sit-to-stands, and walking. So I guess some differences between pubic bone pain and round ligament pain, they're really similar. Round ligament pain, people might feel usually on both sides, but for pubic bone symphysis, they usually experience it on one side. But again, everyone is different, so it really depends per person. So one tip to help you if you're experiencing pubic bone symphysis pain or round ligament pain is to activate your transverse abdominis. So this is a really good picture of the transverse abdominis. And as you can see, it really wraps around the entire abdomen and it provides that support. So I think of it as like a corset muscle. So it really, when it contracts, it kind of compresses 360 degrees and really supports all your organs, your muscles, and so forth. So if you're having round ligament pain or pubic bone symphysis pain, one thing you can do is to try and activate your transverse abdominis with any type of movements that are uncomfortable, such as a sit to a stand or rolling in bed, for example. The way that you do this is that you kind of imagine pulling your belly button toward your spine. So a really great cue you can think about is trying to hug your baby, because when you hug your baby, you're kind of like pulling in. So that's the muscle, the transverse abdominis, that you're trying to activate. So again, a really great cue is hug your baby. You may notice when you do that, your abdomen kind of shrinks a little bit or it starts to tighten a little bit. And that is going to provide you some extra support with these activities. So again, that's a very easy strategy that you can try, and a lot of my current patients find it really helpful with very simple movements. All right, so we just talked about some how physical therapy can help with comfort and pain relief. We'll also go into some labor and delivery prep. So if you're working with a pelvic floor physical therapist, and specifically someone who's trained in working with pregnant individuals, labor and delivery prep can be a very important part of the PT program to decrease risk of tearing, to decrease the labor process, to decrease risk of C-section, for example, if you want to have a vaginal delivery, as well as just, improve your comfort during that period. So whether it's your first baby and you're going to have a vaginal delivery, or a C-section, or a VBAC, so trying to have a vaginal delivery after a prior C-section, pelvic floor physical therapy can be really helpful just to provide you the education and knowledge to optimize that process. So during that process or physical therapy treatment, we may teach you how to do a perineal massage. So again, this is my pelvic floor model. So again, this is the pelvis, and all these muscles here are in red. So a perineal massage would be trying to do internal and external massage of these pelvic floor muscles to make sure that these muscles are nice and soft, pliable, and stretchy. So again, during labor and delivery, when the baby's head's trying to come out, you want all of these muscles to be nice and soft. If they're very tight and rigid, you may end up having to push harder. You could possibly tear more than you want to. So having instruction on how to do that massage can be really helpful. And just another point too is that if you're laying on your back and you're trying to deliver, we typically work on this lower region here, because when the baby's head comes down, it typically stretches downwards towards the anus. So we typically work around this entire bottom half to really optimize the mobility there. We can also work on some pushing and breathing techniques, stretches and exercises to help baby engage into the pelvis or exit the pelvis. We'll also go over that in a little bit too. We can also go over some labor positions with you, safe exercises to do during pregnancy, as well as prenatal or perinatal yoga and Pilates focused exercises. So that's a little overview about what, if you were going to see me for pregnancy, what we might go over. Again, it could be all of these or a little bit of these or even more. So this is not an exhaustive list. So we're going to go over a few stretches to do during pregnancy. So the first one that I really like is the down dog. So the down dog, as shown in the picture, is a really good stretch to mobilize your buttock muscles or your glutes, as well as your hamstrings, to prepare the ischial tuberosities to widen to allow the baby to exit. So I have another pelvic model here. So if you can see, this is your pelvis. And then this is the bottom of the pelvis. So if we're trying to mobilize the hamstrings, the hamstrings attach to these two bones here. So again, this is the forward view. If you're laying on your back, the hamstrings attach to these two bones. And what happens is, if you really mobilize your hamstrings and your buttock muscles, this allows the pelvis to open more. So again, if you're trying to have the baby exit your birth canal, you want mobility from your hamstrings and your buttocks so that these bones can really widen to allow the baby to come out much easier. So you can see, as these bones widen, it creates more space for the baby's head to come out. And again, that can, maybe you don't have to push as hard, you don't have to strain as much. So again, this stretch is a really good one to help optimize your pelvic outlet. And again, during labor and delivery, you have oxytocin and all these hormones that really relax all these ligaments to allow your pelvis to move. So our pelvic bones are pretty pliable. So you want to make sure too that your muscles are also moving very well to optimize your pelvic outlet. Okay, another great stretch to do is a hip flexor stretch. So as you can see in this diagram, the person's laying on their back, they're hugging one knee to their chest, and they're letting the opposite leg hang off the edge of the table. So that's going to really open the front of this patient's left hip. So these hip flexors, as you can see, are muscles in the front of your hip that attach from your lower back all the way into your hip. So as you can see too, these muscles form the inside of your pelvis. So if I have my model here, the muscles are going to be located along these bones. And again, you want as much room as possible to allow the baby to enter into this pelvis. So again, this is a really great stretch. It's a really great stretch if you're having difficulty getting the baby to engage into the pelvis. So again, getting the baby engaged into the pelvis means that you're trying to get the baby's head inside the pelvic bowl. So I have also put this diagram here with the floating, engaged, and crowning diagram just to show you the importance of trying to, if you want to optimize your labor process, to try and get the baby sinking down. And then another great one is the deep squat. So I really like this one as well. It's a great stretch to open the pelvic outlet to help the baby exit the birth canal. If you're not very flexible, you can also sit on a pillow or have a yoga block underneath your bottom so that it's not too strenuous of a stretch. And again, this is a great stretch for opening the pelvic outlet. So if you're trying to open the pelvis and the baby's coming out, you want the bones to be really wide to allow the baby to exit. So with these stretches, I typically recommend doing them during your pregnancy, especially during your third trimester, and making sure you're trying to hold these stretches for at least 30 seconds. A minute would be great, and doing them every day. So these are just 3 stretches that you can do. There are many other, but these are some of my favorite ones. All right, we're going to talk about labor positions. So labor positions are a really important topic because it can ease your comfort. It can make more room for the baby to come out. You want to work smarter, not harder. So one of the best positions for labor is ones in which that your hips are internally rotated. So I'll show what that means in the video. But what happens is when your hips are internally rotated, it allows, again, these bones to move out, giving more space for the baby. So again, this is your pelvis, and this is the bottom. If your hips are internally rotated, it creates more space, again, widening of these bones to allow the baby to exit. So hopefully this model helps with that. I'll play this video and I'll stop it a few times. So the first one that you can do if you want to deliver on your back is you want to lay on your back, and you can roll a towel into like a U shape, and then you can place that underneath your 2 sits bones. And then you just lay on your back, and you want to have your knees together and feet apart. So this is what I mean by hips internally rotated. So when your hips are internally rotated, your knees are going to be very close together, feet are very wide to optimize that outlet. So the reason why I recommend a towel underneath your sits bones is because it allows your tailbone to move out of the way. So if we go back to my model here, so again, this is your pelvis, this is the bottom view. This tailbone here, you can see, this one needs to move out of the way to allow the baby to come out. So if you're kind of sitting on it, there's going to be not much room for this tailbone to move down. But if you sit on a towel roll, it gives space for this bone to move down. So again, the towel roll is a really great option. Another great position is quadruped. So being on your hands and knees or being supported on a birth ball, again, with your hips rotated in. So again, knees together, feet apart. And then the last really great position is side lying. So you can lay on your side with a ball or even pillows between your ankles, and then just have your knees together. So again, as you can see, all of these positions are varied, but they all kind of follow the same idea of having your hips rotated in to optimize the pelvic outlet. I strongly recommend different positions. Some positions you may note that you can relax more in, so it really depends on what's most comfortable for you. Typically, a lot of doctors will have you deliver on your back in what's called the lithotomy position. That's okay too, but again, if you're going to do that, really try and use that towel roll to make sure there's enough room for the baby to kind of exit your birth canal. You can also, again, try different positions: side lying, hands and knees, sometimes standing, holding onto a chair. Again, there's a lot of different positions, just what's most comfortable for you. All right, and then next we'll go over some pelvic floor and core rehabilitation. So you may be having some urinary leakage or constipation during pregnancy, or feeling like you're seeing some bulging in your abdomen because the baby's growing. As pelvic floor PTs, we can also help you strengthen your pelvic floor and core to address any of the symptoms that you may be having. So I'll first talk about some pelvic floor rehabilitation. So I'm just going to show my model again. Again, this is my lovely pelvic model. And then all of these muscles in red are your pelvic floor muscles. So there are a lot of them, and they are very important in urinary function, bowel function, and sexual function. So whether you're experiencing some urinary leakage or having to wake up a lot at nighttime, or constipation, leakage of stool, or having pelvic pain, we can be a very good resource to help you with those symptoms. It's important to get them addressed early, because sometimes the symptoms will, if you're not addressed during pregnancy, they'll prolong into the postpartum period. So it's always good to get them checked out earlier than later. We may also help you with some core strengthening. So diastasis rectus abdominis is another very common condition that 99% of moms have. Maybe 100% of moms. But what diastasis is, it's the separation of the abdominals, and it has to happen in order to create space for the baby. And what happens again is that the abdominals start to separate. So they start to go off to the side, and then you get this thinning of the linea alba. So the linea alba is the space between the two abdominal muscles that starts to become really thin. And people tend to notice bulging in this middle umbilical belly button region, because that tissue is really thinning to accommodate the baby. So you may be wondering, what type of exercises should I be doing? Is this exercise going to make it worse? I'm seeing this weird bulging in my belly. Is that like a hernia, or do I feel like my organs are kind of poking out? So it's, again, something that can be treated with therapy and has very good success as well. So we'll kind of dive into that. So how do you know if you have one? So what you can do is you can lay on your back, and you want to place your fingertips along the midline of your abdomen. And what you're going to do is, as you place your fingertips there, you're just going to lift your head up, and you're just going to assess how deep my fingers go, how wide is that space, and you want to check above, at, and below the belly button. So these are just 3 different areas you want to check. Having a separation of more than 2 finger widths is diagnosed as having a diastasis. So again, this is something that's usually easier to check early during pregnancy or postpartum. As you get bigger during your 3rd trimester, it might be harder to lay on your back and check. But it's a really great way to self-check to see if you may need to get some treatment for that. Again, how do you know? You might see some abdominal bulging or doming. So in this picture on the left, this patient is laying on their back, and you can see a little bit of coning or doming here. So that is just pressure being exerted on the belly due to the thinning of the abdominal wall. So again, as your belly gets bigger during your 2nd and 3rd trimester, your tissues start to thin out to accommodate the baby. But afterwards, during postpartum, your tissues don't go back to the way it was. It's still going to be kind of thin. So that's why you may notice more of this bulging and doming during the postpartum period. That may indicate you have a diastasis. Here's another great photo on the right. The bottom photo showing a diastasis. So you can see if they try and do a curl up activity, that stretched linea alba, that connective tissue between the two abdominal muscles here, is causing that doming present. So really great photo. And what treatment looks like. So it's a very individualized treatment that focuses on strengthening the entire abdominal wall. We may use some kinesio tape to decrease the tension on that linea alba. We may also do some manual therapy to encourage that closure of those two-side abdominal muscles. And we may even do some Pilates. So the treatment for this is varied. Again, it includes a lot of different components. So seeing a pelvic floor physical therapist is really great if you're interested in pelvic floor and core rehab. All right, and then lastly, we'll talk about just preparing for the 4th trimester. So yeah, if you do plan to see a pelvic floor PT during pregnancy or just seek out help, we can also help you prepare for that first initial postpartum period. So we may educate you on some nutrition measures. If you had a C-section, for example, bone broth is really helpful for healing of your tissues because it has a lot of protein. Sometimes after you deliver, it may be uncomfortable to have your first bowel movement or to urinate for the first time because that area is very sore or very tender. We can teach you some techniques or strategies to ease the pain. If you had a vaginal delivery and you tore, so there's different degrees of tearing, as you can see, we can facilitate healing for the tear or episiotomy, as well as teach you some home program exercises for that recovery. And then same thing for a C-section. If you had a C-section, we can also teach you some techniques to help that heal easily so it doesn't impact your organ function, for example. We'll also provide some breastfeeding tips and strategies. We may also provide an exercise program that you can start with during your first few weeks of postpartum. And then I usually also go over what to expect 6 weeks postpartum. So typically after you deliver, you have a OB appointment 6 weeks afterwards just to check your pelvic area, just to make sure everything's healing. But we'll also go over what that 6 weeks looks like. And again, it's not, a lot of people think, oh, 6 weeks, they're back to normal, but it's not usually like that. It does take time to recover because your body has undergone 9 months of change. So having a 6-week bounce back isn't all that realistic. So we talk about what realistic expectations are after you deliver. And I always like to remind people that once you're postpartum, you're always postpartum. So pregnancy is it causes a lot of change in your body. And it's important that if you're experiencing any changes with your urinary, bowel, or sexual function, or in your abdominal region, or your back pain at all, it's really great to assess it earlier than later so that you're not developing the wrong patterns of movement or compensating by using other muscles because your prior muscles are not working as well. Okay, so yeah, today what we went over again is just 4 different areas that we may help if you're pregnant. We also went over some stretches you can do during your pregnancy, as well as just information on labor positions. Treatment, if you do plan to see a pelvic floor PT, will be more individualized to what you're experiencing, but I really hope that this webinar gave you some good information about, I guess, how physical therapy can be a really helpful resource during your pregnancy. So if you have any questions, feel free to type them in the chat. You can also feel free to email me. I put my email here, and you can just let me know if you have any questions. We are doing Q&As once a month, so if you are interested in joining our next one, just be on the lookout in your emails. Each month is usually a different topic, so the topics do vary. And if you have specific topics that you'd like us to talk about, you can also let me know as well so that we can gear it towards your interest. Yeah, so if you have any questions, feel free to type in the chat and then I'll answer them. So you can take your time as well. And if there are any slides that you want me to go back to, just let me know. Okay. All right, so someone asked, are there any blogs you recommend to learn more about this topic? Yes. So if you follow us, actually, we have an Instagram. It's called, I think, PhysioFit PT. We post a lot of videos, like reels, really quick videos that can be really helpful to kind of demonstrate a few things we might do in the clinic. But we also do blogs on our website if you're interested in learning more about that. Other great ones that I really like on Instagram, I think it's Mama Stay Fit, but there are really great resources out there that a lot of pelvic floor PTs put together just to educate our community. Because I think a lot of my patients, for example, don't know that PT is an option during pregnancy and they wish they had knew. So there is a lot more, I guess, talk about it going in our communities for that as well. And someone asked, does pelvic floor PT involve mostly internal manipulation or can it just be external in some cases? So it can be both. It totally depends on what you're comfortable with. Some of my pregnant moms will defer doing any internal work. Internal work has to be appropriate too. So if you have, for example, like a shortened cervix or, something that your doctor says don't have intercourse or any internal, too much internal work done, they might let you know so that you can let the PT know. But yeah, it totally depends on your situation. A lot of my patients who want to learn like the perineal massage during pregnancy, I will actually work on them internally and show them how to do it so that they can do it on their own. But yes, it can involve actually both. But yeah, for example, I do have one patient, she had a C-section for her prior pregnancy and now she is having another pregnancy. So even when she's pregnant right now, we're working on her old C-section scar from previously just to ease that up, as well as she was having some pain associated with that. So yeah, it can involve a little bit of both. So let's wait here if you guys have more questions. Okay, so I have another question. So the question was, when is it appropriate to see a pelvic floor PT after delivering? So usually I recommend 6 weeks, but sometimes I'll see my patients earlier than that. Any internal examination, for example, vaginal or rectal, is not, I guess, cleared until 6 weeks of seeing your OB. So most of my patients will come after their 6-week visit so that we can do a little bit more. But sometimes I'll start some of my patients earlier if they want to start getting their core working or their pelvic floor muscles just gently activating 3 or 4 weeks postpartum. So I would say you can definitely come in earlier or you can come in at the 6 weeks as well. But I always recommend any postpartum individual should see a pelvic floor PT just to make sure everything looks good because like I said, once you're postpartum, you're always postpartum, and issues that you may not notice during early postpartum, you may notice after menopause or when your body starts to undergo a lot more change. So it's a really great option just to make sure everything looks good. So if there are any issues that the PT may be noticing, that you can address them early. All right. Okay, so if there are any more questions, feel free to email me. I'd be glad to answer them. For attending the Q&A, I believe you'll also get a recording, so you can watch it later as well. And you can just let your friends know about any of this information you learned too. It's going to end in a few minutes, but again, just waiting if anyone else has any last minute questions. Okay, just one more question. So if I'm pregnant, but I'm not having any pain, should I still see a pelvic floor PT? So I even have some patients, for example, who are not experiencing any pain, but they'll come for pelvic floor PT just for a few sessions, maybe 2 or 3, just to learn about like labor positions or breathing techniques, pushing techniques, just to help, improve that experience with labor. And then again, that's a really great idea as well. I have many patients who do that. And I do definitely think it works. I have a lot of patients who have seen for pregnancy and then they don't even tear, or they tear very minimally, or their birth plan goes, well. So yeah, even if you're not experiencing pain and you just want to learn more about, how to prepare for postpartum or just to optimize your labor experience, it's a great option. Okay, and then someone asked, how long before I feel a difference from physical therapy? So I think that's a really good question. It really depends. Some patients will notice an immediate difference because with my treatment strategy, I really try and focus on function and trying to teach them techniques to relieve their pain immediately with any type of aggravated activities. But let's say diastasis. So if you have a diastasis rectus abdominis, that typically takes a lot more time to heal. So I usually like to give the timeline. You've had 9 months of pregnancy to stretch your abdominals, and now you're trying to bring your abdominal back, your abdominal wall back to what it was pre-pregnancy. So for example, with diastasis, it takes a lot longer to see a difference because it takes time for muscles to adapt to the loads you're putting them on. So muscles take at least 8 to 12 weeks for strengthening. So being sure, for example, you're really good about your home program and your exercises is really important. But yeah, I guess it really depends on what you're coming in with. Okay, and then another question. My mom and grandma and sister all have bladder leakage or pelvic prolapse. Does that mean that there's nothing I can do to prevent it from happening to me? So I definitely think there is a lot you can do to prevent that. One of the biggest causes for pelvic prolapse, well, one of the risk factors is having a vaginal delivery or longer time, pushing or a lot of strain on your pelvic floor. Another contributing factor to prolapse is straining because you're constipated. So yeah, there's definitely a lot that you can do now to prevent that, whether it's urinary leakage or just having a pelvic organ prolapse, to get that treated too. But good question. Yes, and then one more question. Can I talk to a therapist before I book just to confirm pelvic physical therapy is right for me? Yeah, great question. So if you're unsure if you want to commit to seeing a pelvic floor PT or you're unsure if it's going to be helpful, you're always welcome to, for example, if you're interested in seeing one of the therapists here, you can set up a phone consult or do a discovery visit. And that is just time that you can spend with talking with someone before you commit for an evaluation. So the phone consultations, again, are a common option that people will do just to maybe get to know the therapist or see if they are appropriate for physical therapy? Great question. All right, so again, thank you so much for attending the Q&A. If you have any questions, feel free to email me and I'll make sure to respond within 24 hours. Yeah, thank you so much for attending. Be sure to try and attend our next Q&A. Thank you.